that is where this spinal cord ends, and below that you have just the nerves going off, but not actually the spinal cord. And then the spinal canal, as you call it, the canal in which the spinal cord is, hello friends, I am Dr. Ann, an anesthetist, a doctor. If you would like to see more of my content on YouTube, subscribe to the red color button over there, and let's go on a journey and discover more about anesthesia and medicine. Okay, so today I am going to be talking about the history of anesthesia. I have my laptop, I have done my research, but more than research, just being an anesthetist, we read about the history of anesthesia in our textbooks, and I have really been intrigued by the history of anesthesia, so I thought that I should make a separate video about the history of anesthesia. So here goes. But starting with history, everyone must have heard that in the olden days, we might have seen cartoons or pictures where the people just give a knock on the head and they're out, and the surgeon does surgery on them. So probably in the olden days that was how it was done. And then they were also using some plants like or drugs also, like opium and cocaine, to help ease the anesthesia. So that was the olden days, and it wasn't a science back then, so I won't be diving into all those very ancient details, but I'm going to be starting from when it actually became a science, and there was actually research and how doctors found all the medicines linked to anesthesia. So let's dive into the actual history of anesthesia. Let's go. So it was 11th December 1844. There was a dentist. His name was Horace Wells. Actually, he saw a man who hit his shin on a bench, and he miraculously felt no pain. On investigating, he found that the man had been inhaling nitrous oxide for pleasure, and that's why he didn't feel pain. So being a dentist, he was actually practicing in Hartford, Connecticut. He saw this incident on 11th December. On the very next day, on 12th December, he tried inhaling a bag of nitrous oxide and made his friend, a fellow dentist, Dr. John Riggs, to extract his own tooth to test out the anesthetic properties of nitrous oxide on himself, and it was a success. But Horace Wells didn't want to apply a patent for nitrous oxide because he said he felt that anesthesia should be as free as the air. So, such a kind heart, right? So that's how anesthesia started. However, the first public demonstration of surgical anesthesia was in 1846 only. That's after 2 years. WTG Morton, he was a dentist, and he tried using ether for anesthesia, as another surgeon removed a tumor from one of his patient's neck. But after all this, to make anesthesia popular, no one really preferred having anesthesia for the surgery, because people really didn't understand how anesthesia worked, and they felt like, what is this miracles and how can you explain it? And they really didn't want to be under this magic spell called anesthesia. So it wasn't really popular in the 1800s. And then there was another Scottish obstetrician. His name was James Young Simpson. He tried other gases to see if they could be used for anesthesia, and one day on November 4th, 1847, Dr. Simpson and his two friends, Dr. Keith and Dr. Duncan, they inhaled chloroform and found it to produce a light cheery mood before they collapsed under the effect. And unlike ether, it wasn't unpleasant to smell. So doctors started using chloroform instead of ether from then on. And a few doctors started working on anesthesia to learn the properties of the gases and to gain experience and skill over the subject. One such doctor was Dr. John Snow. He administered chloroform for the birth of Prince Leopold in 1853 and Princess Beatrice in 1857 to Queen Victoria. And saying that now that the royals were using anesthesia, it started gaining popularity and now everyone wanted anesthesia for giving birth to their children. More and more people started acquiring skills in anesthesia, and anesthesia finally became a field. and started gaining recognition. And literature was also published in those days. And in some other parts of the world, cocaine was used regularly, but topically for minor procedures. There was this one surgeon, Dr. Karl Koller, he tried using cocaine for anesthesia into the eye. That was a very risky move. And previously, surgeries on the eye was very difficult because when even when you know that when you can't really touch your eye, right? So surgery on the eye without anesthesia, you'll be constantly blinking, and it was a really complex surgery. And Karl Koller tried introducing cocaine into the eye, and it was successful for him. So local anesthesia started gaining popularity after that. And finally, in 1947, Dr. J.M. Graham attempted to inject local anesthetic into the spinal fluid to administer spinal anesthesia. So before I go into it, I just want to talk a little bit about spinal anesthesia. I have a lot of people who come up to me and say, "Ma'am, I have this pain in my back from when I got spinal anesthesia, and I think that the doctor injected the local anesthetic into my spinal cord, and that is why I am having problems, this back pain." And I just want to make it clear to all my audience, because it's a very common misconception that anesthesia is given into the spinal cord. That is not true at all. Anesthesia, the local anesthetic, is given into the spinal fluid, and that is why it's named spinal anesthesia. Actually, the spinal cord ends in the level of L1. That's in the back. In the back we have our vertebra, our backbone, and it is divided into segments, and there's this one segment called L1. That is where this spinal cord ends, and below that you have just the nerves going off, but not actually the spinal cord. And then the spinal canal, as you call it, the canal in which the spinal cord is, it goes deeper, and spinal anesthesia is given only in the level of either in between L3 and L4 or between L4 and L5. So there's not really the spinal cord is not really there where the local anesthetic is injected. Anesthetists inject local anesthetic into the spinal fluid and not into the spinal cord. So I want that to be real. I want everyone to be really clear about that. And there is this thing, right? If you feel that, if you start believing that your anesthetist injured your spinal cord, it'll become a reality, because you might start getting pain and you might start attributing everything, your back pain, probably it's your back muscles or something else. But I don't want anyone to like blame their anesthetist for having back pain, saying that they gave the spinal anesthetic into my spinal cord and that's why I'm having pain. So okay, now we're deviating off the topic. So let's get back to the history of spinal anesthesia. So in 1947, Dr. J.M. Graham attempted to inject local anesthetic into the spinal fluid to administer spinal anesthesia to Albert Woolley and Cecil Rowe on October 13th. But unfortunately, both of them were left with minimal disability, and spinal anesthesia did not grow much in popularity. And then after a few years, after research, it's quite popular now. With all these advances in anesthesia, and now we also use all these medicines which alter the normal functioning of the systems of the body, and the field of surgery is also advancing, the need for medically qualified anesthetists arose. Initially, nurses were trained in anesthesia, but it seemed like anesthesia needed more care, so doctors started being trained in anesthesia, and then it finally became a separate branch of medicine and anesthetists were born. So it wasn't until the 1900s there was a doctor was named as an anesthetist. Previously it was someone else who was taking care of anesthesia. So doctors were trained in anesthesia in 1935. The first postgraduate examination was conducted, with training being in both regional, local and in general anesthesia, as it is to this day. And now anesthetists are also trained in pain management, in palliative care, critical care and emergency care. So looking back at the history of anesthesia, with all the advances in the field of science and chemistry, advancements in the study of medicines and gases for anesthesia, it has really helped mankind evolve in the specialty of surgery as well, with the knowledge of the pharmacodynamics and pharmacokinetics of medicine used in anesthesia. It is very safe to use anesthesia in these modern times thanks to the past centuries of research into the field to refine the subject. So the next time you require anesthesia, know that it's a relatively new science, but you're in safe hands because it has really been refined with all those years of research, and mainly the scientists and chemists who studied all the gases that we're now using and all the medicines that we're using to refine it and find out all the toxic doses and all, and now it's pretty safe. So did you enjoy the history of anesthesia? I have always been intrigued by it, and I thought that's why I wanted to share it all with you. If you like my content, and if you liked hearing about the history of anesthesia, make sure to like my video and comment down below what you thought about it, and if there's something you'd like to talk to me. And don't forget to subscribe to my channel. So till we meet next time, bye.